Fiasco, which I think stands alongside the testing fiasco, to me feels like a point that's worthy of focus because it seems more fixable. The testing thing, we obviously screwed that up royally as a country. They are trying to scale it up. A lot of effort is going into that. It's still going to take a long time, and it will hamper our efforts until we've got it in place. Meanwhile, without testing, all we can do is large-scale mitigation efforts, like getting rid of...
China has had enormous success in beating down its epidemic stay. So those are the cases. They're isolated away. They're hospitalized, and people actually sort of move through the system. Suspect cases, mild to moderate cases, and hospitalized, severe, and critical cases who are actually in hospitals. And the crucial thing about that system is break the chains of transmission and also do what you can to keep the hospitals from getting overwhelmed. Because when the hospitals get overwhelmed, you have to say, okay, she lives, but he dies, and he dies, or whatever. You know, she's young and has kids, we'll save her. Grandmother, goodbye. Those are the choices they are making in northern Italy right now, and they're going to be making them all over Italy pretty soon. And we will too.
Donald McNeil, science and health reporter for the New York Times. People are going to clip this and send it to their local health department for having you describe this because of the distance between what you're describing and what we're doing and what we're preparing for. But thank you. Donald McNeil, reporter for the New York Times. Thank you.
I know you just got there a couple hours ago. Just what's it like from what you've seen so far?
You know, you get the feeling, Anderson, that this is a city trying to awaken once again. I mean, it was a 76-day brutal lockdown, harsh conditions in many of the communities here. Folks couldn't leave their homes. They were sealed off, not even to go outside to get a little bit of air. And so you start to see it's coming back. In fact, one of the things that we're struggling with here is the background noise of traffic. But that's a good sign, right? I mean, that means that clearly folks are trying to get back to life, trying to get back online with their businesses. Kind of surreal. I mean, the last time I was here was late. Now, let me show you, as you can see on the train that we finally were able to get on board out of Shanghai, there were a good number of people there. I mean, people, locals in particular, are traveling once again within China. What's interesting, though, is that we've seen less and less of the kind of largely protective garments that people were wearing. I mean, the white hazmat suits that we saw just a few weeks ago when we were traveling, people have seemed to shed those for the most part. Everybody wears them.
And you know, you've shown us in the past this code on your phone that gets you into public places. Will traveling to Wuhan change that at all? I mean, it's an unbelievable system there. For a lot of reasons, it probably would not exist in the United States. But will you have to quarantine once you leave Wuhan?
This QR code is the golden ticket, and the way it works, as we've explained, is each jurisdiction has their own. So ours in Shanghai, for example, doesn't necessarily help us get around here within Wuhan, but it does help us check into a hotel. So it's the first thing they wanted to see before even letting us into the door of the hotel to go in and continue the check-in process. As of now, ours has remained green. As you know, green is kind of the clear all to go through. If it goes yellow or red, you can be flagged for quarantine. Of course, we're hoping that it remains green, and it should remain green according to how the Chinese government has said that Wuhan has technically reopened. Hubei province, the original epicenter, is now back open and people are able to leave freely. And so the idea is, at least from the government's perspective, that people who leave Wuhan are able to go back into other cities within China and resume their normal lives. We'll see if that holds true for.
And experts are saying that China is an example of how to contain the virus. President Xi Jinping has called the major public health emergency both a crisis and a big test for the country. So how did China do it? The virus is new and runs rampant without an effective cure. The novel coronavirus disease took hold in central China's Hubei province. It then evolved into a public health emergency that is the hardest to contain for the People's Republic of China since its founding in 1949. Challenge is huge, but China's measures are tough. As some media reports and experts note, China takes advantage of its social system and gives full play to the role of the government. Concentrating resources to solve major problems, as Chinese often put it, is how China has overcome major obstacles over the past decades. Under the command of President Xi Jinping himself, a series of measures unprecedented in history have unfolded.
The Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak. Wuhan people and Hubei province in general they're paying a lot. It protects their people, and also it protects the rest of the world. And doing this for humanity is something beyond words.
To the people of Wuhan, it is recognized that the world's in your debt.
More than 40,000 medical workers have been sent to Hubei. 2 makeshift hospitals, Weishanshan and Hushanshan, were built and started operation in more than a week in Wuhan. Venues like gyms, conference and exhibition centers in Wuhan have been converted into temporary hospitals to treat patients with mild symptoms. For other cities in Hubei, 19 provinces have paired up with them to provide one-on-one support.
The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words. So is China's commitment to transparency and to supporting other countries.
Experts say China's measures have proven effective. Many of them highlight the country's social system and the government's capacity.
Now the outbreak in China is on the decline, and there is a significant decline. And this is because of the government's leadership and at the same time the cooperation of the people of China.
It's a remarkable response that's being organized in China to contain the virus. And everybody, as I said earlier, needs to recognize the remarkable efforts that China is making to deal with this problem.
The rest of the world would be access the expertise of China, and they've done this at scale. They know what they're doing, and they're really, really good at it, and they're really keen to help.
The experience that China has with COVID-19, the work that they are doing and taking an evidence-based approach to this response is something that the world needs to learn from.